the editor-in-chief of Neurology Today, and I'm here today with Gregory Branigan, a graduate student researcher at the University of Arizona College of Medicine, and he's going to talk to us a little bit about some of the work he's been doing around estrogen-modulating therapies and risk of dementia and Alzheimer's disease in breast cancer patients. So, first of all, Greg, thanks for joining us today. Can you tell us a little bit about your work?
Of course, and thanks for having me. So we conducted in the Center for Innovation in Brain Science at the University of Arizona a retrospective clinical study looking at patients and women specifically who are perimenopause to postmenopausal who were treated for breast cancer. Historically, the treatments for breast cancer include estrogen targeting therapies that are known to decrease the level of estrogen at the breast tissue, and it's really unknown what that does for estrogen levels in the brain. And we know that with Alzheimer's disease and kind of this prodromal effect that we see, that there's a lot kind of leading up to that development of Alzheimer's disease. And for years, there's been a mounting evidence that the decrease in estrogen in this perimenopause to postmenopause transition is resulting in an increased risk of Alzheimer's disease. So we were looking at whether patients who had this as a kind of a chemical decrease in estrogen through the treatment of breast cancer, what the actual risks would be in these populations. What we're able to find is that actually these therapeutics, which are predominantly the selective estrogen receptor modulators, tamoxifen and raloxifene, actually have a really interesting pharmacology where they're acting as an estrogen antagonist in breast tissue, but potentially acting as an estrogen agonist in brain. So we actually see a reduced risk in these breast cancer therapies over a long-term period of the exposure.
So what do you think neurologists should take away from these findings in terms of their practice?
Please. I think the big thing for the translation of these findings into the clinic and as a neurologist is to really kind of push forward this call for precision medicine and an understanding of how systemic therapeutics that we're treating for common diseases in at-risk populations of aging patients are going to be affecting the brain long-term. And really a push and a call for more basic and translational research of understanding how therapies that obviously reach the brain are going to affect that in our aging population.
And I think, as you implied earlier, these findings are maybe a little counterintuitive, right, to what we would have thought might happen. So, what are some next steps that you and your group are going to take to, confirm these findings and to study this further?
Yeah, that's a great question. So for us, and this is actually a lot of my thesis work, is then working out the molecular pharmacology of how these therapeutics are actually working in the nervous system and in the brain, using both animal models, cell models, and human patient-derived cell lines. So we have the opportunity to really work out kind of the mechanism and give a pipeline and an opportunity to really come up with ways to study these therapeutics.
Yeah, I think that's really great. And, at Neurology Today, we have a whole section on, disease mechanisms. We really like to think about how diseases sort of originate. And it's hard to understand that if you don't really understand the core foundational, processes that are happening at the level of the neurons, for example, or the glia. So, it's always been historically the case that, estrogen and hormone replacement therapy has been complicated in terms of, what it benefits and what it doesn't. And I think it'll be really interesting as especially we move into a precision medicine era to understand, the individualized, factors that come into play when we think about counseling women, for example, around things like HRT. And of course, in your case, your study really looked at necessary medications for breast cancer treatment, but, perhaps those findings will translate to some broader understandings and implications. So I want to thank you for doing this really interesting work, and we really look forward to seeing what comes next. Thank you.
Thank you so much.